Welcome to the series, Vitamins for Whole Health. Short lessons on the vitamins that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about vitamin B12. Vitamin B12 is also called cobalamin. It is a water-soluble compound, meaning it mixes well with water and not with fats. As molecules go, B12 is the most complex of all vitamins. Just look at that diagram. This is the only vitamin that you cannot get without consuming animal products, unless that is, you use a supplement. What does vitamin B12 do? If you've seen the folate entry in this series, you know that B12 plays a role along with folate in controlling homocysteine levels and moving carbon atoms around, which relate to DNA activation and deactivation, as well as detoxification and other uses. It is also required by a key enzyme to produce succinyl coenzyme A, which is essential for the proper function of your energy production process, and is also essential for the synthesis of hemoglobin, which is the molecule used by your red blood cells to carry oxygen. Adequate B12 is protective against cardiovascular disease, as well as cognitive decline, and particularly age-related cognitive decline. As it is common for the body to lose its ability to absorb B12 with advanced age, it is thought that much age-related cognitive decline could be due to the absence of B12 in this population. Cases of overt vitamin B12 deficiency typically manifest as megaloblastic anemia, where the red blood cells are malformed and bloated, causing them not to be as efficient at carrying oxygen. Pernicious anemia is not a symptom of deficiency so much as a cause. This is an autoimmune condition wherein the body has destroyed the cells which secrete intrinsic factor, a necessary molecule which attaches to the large cobalamin molecule to allow its absorption in the small intestine. Without intrinsic factor, absorption becomes impossible, and the resultant anemia is called by the name pernicious anemia. Another symptom of B12 deficiency is nerve damage, which can manifest as tingling and numbness in the extremities, memory loss, confusion, and other symptoms of dementia like depression. In some cases, seizures can result. Regarding the symptoms of nerve damage, obviously there are differential diagnoses for these, so if you are experiencing any such symptoms, please consult with your doctor. For groups at risk of vitamin B12 deficiency, we have 1. Vegans and vegetarians, due to potentially inadequate animal products in the diet to account for vitamin B12 needs, requiring supplementation to correct. 2. The elderly, who can have a deteriorated ability to absorb vitamin B12 or maybe on medications which hamper this process as well. Those with stomach problems, which generally impact absorption, and most especially those with inadequate stomach acid or intrinsic factor, both components the body requires to absorb B12. Those with a history of bowel surgery can also face an overall decline in their ability to absorb B12. And number 4, as I inferred a moment ago, certain medications can affect your ability to absorb B12. Proton pump inhibitors through lowering your stomach acid, needed to cleave the B12 from your food, and metformin through blocking absorption. The requirements for B12 are as follows. Men need 2.4 micrograms per day. The requirement is the same for women, except in cases of pregnancy, which require 2.6 micrograms daily, and when lactating, which requires 2.8 micrograms daily. Good sources of vitamin B12 include the following: liver, fish and shellfish, red meat, eggs, poultry, and dairy. Regarding fortified foods, this can be anything with B12 added, such as soy and nut milks, plant yogurts, or what have you. There is no toxicity associated with vitamin B12, and up to 1,000 micrograms per day is considered safe. There are many supplements that exceed this amount on the market, Of course, a good rule of thumb is to check with your doctor before beginning a supplement regimen. Thank you for viewing the vitamin B12 entry in the series, Vitamins for Whole Health. We'll see you around.